Hello, so we're gonna talk about reflux esophagitis. The esophagus is this squamous epithelium with a lamina propria, and there is a muscular layer with a submucosa, of course, before that. So the most important part here is the mucosa that we're looking at, and we need to know that there is this mucosa composed of the squamous epithelium with a basal layer that is attached with a basement membrane, and this is the lamina propria that can have the capillaries supplying the tissue here. Okay, these are lymphocytes, these are important, and this is Reed pegs, this is the tongue projection, this is when it is reactive. All right, so for our findings in here, what we want to find are three things: the triad, that's the most important part here. Basal layer is more than 15%, okay, 15% or more of the thickness of the mucosa. Lamina propria is 2/3 of the length of the mucosa, as it is here. Okay, so it's supplying more, there is more dividing cells, and intraepithelial lymphocytes are increased as well. They are found normally, but they are increased in some circumstances, like with reflux esophagitis. Very important to look for Barrett's esophagus because it's a complication. Other things you might find are ulcerations, granulation tissue. Granulation tissue basically as is under the ulcer with mononuclear cells. You might also find eosinophils, and beware not to beware of people who might have eosinophilic esophagitis. Neutrophils can be found there, and of course we have to beware of infections. Other things to remember: it clinically can occur at any age, usually with people above 40-year-old. Reflux complains of the patients coming with, heartburn, dysphagia, and other reflux symptoms. If complicated, we mentioned Barrett's esophagus, but it can also become a stricture in the esophagus. With gross examination, doesn't really matter because we receive biopsies for this one usually. You have third or 30% of those patients with normal or slightly erythematous mucosa on endoscopy. The endoscopist, basically the gastroenterologist, takes the erythematous area that is probably gonna have the change, and generally they grade it with the Los Angeles classification system, from mild to moderate to severe to very severe reflux or gastroesophageal reflux disease. Okay, thank you.